Hello and welcome to From the Floor on our conference channel. As my team and I walked around the exhibit floor at the Health 2022 conference, I realized two things. Many health IT professionals could not make it this year because of travel restrictions, busy schedules, and other reasons. And many excellent healthcare solutions were ready and willing to help propel healthcare forward. So here we are from the floor for you to see what you may have missed. Right. So we try to have short conversations with each of the people in the booth and revealed what their solution was, what kind of problem they were trying to solve in healthcare, and the subsequent solutions to those problems. So we hope you enjoy this new series. We're trying it out at the health conference. If it works out, we will continue to do it into next year. Special thanks to our conference sponsors, Sirius Healthcare, VMware, Transcarent, Press Ganey, Sempris, and Veritas for choosing to invest in our mission to develop the next generation of health leaders. And now to the floor.
Hi, yes, my name is Noel Khirsukhani. I'm the Chief Growth Officer and one of the founding members of Andor Health. Andor Health was actually born about 4 years ago. We're a Microsoft M12 portfolio company. We actually really came to the market, really focused on building a virtual health and team collaboration platform that was powered by artificial intelligence and NLP. The idea that we originally started with was kind of being the next Slack for healthcare. That's really what we wanted to do. So the idea was to really bring signals that actually are born from data that's in the EHR and allowing healthcare institutions and health systems to fundamentally create workflow experiences that I could push to whoever I need to at the end user level.
And what is the problem you're trying to solve in healthcare?
Oh, that's a great question. When you think about the notion of virtual health, collaboration, and orchestration, one of the things that we heard from our healthcare institutions is that when you think about the video endpoints, they're all commodities now. There are a lot of telehealth players that are in this space. You could probably throw a stone anywhere here and hit one. But fundamentally, if you're a health system, the big problem you're running into is all these siloed-based technologies, different RPM solutions, different virtual visit solutions, different digital front door solutions. How do I actually create one distinct experience, not just for the patient, but one pane of glass for the clinician to operate as the patient goes through their journey? So fundamentally, the platform that we built was actually one that is called a virtual health orchestration platform. I can create and establish distinct configurations of workflow around any video endpoint. Could be Teams, could be Zoom, could be Google G Suite. Fundamentally, we really don't care what that endpoint is. It's about getting the right context to the right participant into the right virtual experience at the right time.
And who at the health system would you like to talk to, and what is the conversation you want to have with them?
Great question. One of the key things that we find is that a lot of healthcare institutions are thinking about the delivery of care in a virtual environment, right? Whether you're thinking about new paradigms like hospital at home, remote patient monitoring, or even things like virtual triage, which we're seeing more frequently of. Most of those types of decisions and conversations are stemming right from the clinical side. Chief medical officers, CMIOs, chief nursing officers, all of which are dealing with very, very specific issues. The first, how do we create access to care, but in a way that doesn't overburden my health system? Number two, how am I going to deal with the shortage of all the staff that I have clinically, nurses, clinicians? Is there a way that I can leverage virtual capabilities to scale my existing infrastructure, not add additional staff? The third and final piece that we talk to these folks about are, how do we reduce the burnout? For example, if I'm a clinician that needs to bring in a specialist into a consult, do I need to pick up a phone or text a buddy of mine and let him know to join the Zoom link? That's more burden than I want on my clinicians who already have to deal with managing care. Wouldn't it be nice if I could have a platform that could automatically identify, for example, a neurologist that's on shift, that's associated with my facility, and allow the platform to bring that clinician in with context right into the experience on demand? So we're trying to shore up those three primary things that are top of mind for our CMOs, CNOs, CMIOs.
And then the last thing is, are there any use cases you'd like to share?
Absolutely. A lot of our customers we really lean on for these types of case studies and use cases that we work with. One of the big areas that even one of our customers, the Hospital for Sick Children, actually published in the Canadian Journal of Medicine was around our digital front door experience. Now, the notion of a digital front door has taken on a whole ton of different concepts, for lack of better words. Our belief is that you need to have a way that a patient can access care, but one that actually, as I mentioned before, isn't going to overburden or overload the health system. At the hospital for sick children during the pandemic, one of the big problems that they had was a heavy, heavy compression in the ED, because quite honestly, no patient even knew what could be done virtually. So the first thing they were going to do is go right to the ED. What we implemented for them in our digital front door is an AI-driven symptom triage capability that's more than just a symptom checker. That's a very, very big difference. The symptom triage mechanism takes into account what is the patient experiencing, and based on the lines of service within the organization, I can navigate a patient to the right line of care, through the right modality, whether it's virtual, on-site, whether it should be on demand, or whether it should be simply scheduled. By doing that, in their case study, they showed a reduction in unnecessary ED visits by 64%. And that was published in the Canadian Journal of Medicine. One of my other case studies that came out from one of my other organizations was Orlando Health. In this particular organization, and as with every one of them, ED is significant. But one of the key things that they wanted to do was try to relieve that by creating a virtual pool of their own providers. Imagine, if you will, I have providers that are basically sitting idle. Wouldn't it be nice if they could literally Uberize their own providers, let the provider turn on their light, and if I needed to triage a patient in the ED, I simply request for that consult and bring that clinician in right out of the gate, right? By doing that, we actually increase the capacity of the ED by 2x. That case study showed that they were able to reduce the left without being seen by 36%. And they showed a door to disposition time reduction of 18 minutes per patient. So they were able to severely or significantly create more throughput by doing rapid dispositions, by bringing in providers from the outside to quickly do those triage experiences.
I am Yvonne Daugherty. I'm the healthcare industry SME for Ushur, and we are a customer experience automation company. We do digital automation, digital self-service for healthcare. So HIPAA secure patient communication that can share information, that can pull information, and seamlessly integrate with CRMs, EHRs. And so if a hospital system, a provider system is trying to reach patients and hasn't been able to do it through a channel, we're really good at reaching the unreachable. We have a platform that's called the Invisible app, and it's an app-like experience that is HIPAA secure, doesn't require an app download, doesn't require a password, works really well on a smartphone. You can do surveys, patient education, appointment setting, appointment reminders, appointment rescheduling, condition management, education. So really anything that a provider system needs to reach a patient or even a caregiver, we have a platform that's incredibly flexible that can allow and facilitate those communications.
What's the problem you solve for healthcare?
Really the problem we're solving is being able to reach the unreachable. So a lot of provider systems try calling. They will try to have people call in, short-staffed. We offer digital self-service that can get to patients, that can get to caregivers through a convenient channel, through their smartphone, get them to appointments, get them to make appointments, get them to get their medication refill requests. It is also doing a lot. We're working with operations teams who are looking to reduce the burden of live calls, especially on office and clinical staff. So we can jump in, and if they're calling in, rather than having to speak to someone, we can direct them to digital self-service to do a lot of common things that don't require a live person to interact.
So who do you want to have a conversation with at a health system, and what's the conversation you want to have?
So who do we want to talk to at a health system, and what conversation do we want to have? We are talking with digital innovation, patient experience. We're talking to a lot of people in operations, clinical operations, patient operations, really anyone who is looking to augment live interactions with very effective digital, HIPAA secure digital, to really help patients get where they need to be, get information they need, and drive down a lot of the burden and the burnout of the staff.
I'm Todd Crosslin. I'm a global industry principal for healthcare and life sciences here at Snowflake. Snowflake is a global cloud data platform. It's basically a technology that sits on top of public clouds that allows our customers and partners to build solutions that are generally analytical solutions, solving all kinds of problems across all of healthcare and life sciences.
And what is the problem that you're trying to solve in healthcare?
Yep, so it's kind of a double-edged sword for Snowflake, because the fact of being a platform, we have many customers and partners that are solving problems from commercial pharma to precision medicine and bringing precision medicine to point of care, to helping payers transition from fee-for-service to value-based care. So we kind of get a rap for, you guys are trying to solve everything, and it's not that we're providing the platform so that our customers can solve the biggest challenges of healthcare.
So if you could speak to anyone in a health system, who would you like to talk to, and what do you want to talk to them about?
Yeah, and it's kind of a broad question. You know, we can go into the office of the CIO and have a great conversation about modernizing their technology stack and moving to the cloud and being able to provide, you know, the agility and the speed and the capacity to do what it is that their business partners want to do. And then on the flip side, we also then work with the business side, or in healthcare, the clinical side, or the financial teams. So we'll walk into the office of the CFO, the CMIO, you know, your head of operations, and, you know, working with our partners, we have a massive partner ecosystem. We enable them to solve the challenges of anything, clinical, operational, or financial.
Are there any use cases that you would like to highlight?
Bringing that to mind, I think when you look back on the pandemic and what happened, you know, very early on, one of our health systems, you know, as many made the massive transition from inpatient to virtual to hybrid care, and they're very robust Snowflake users. And what they did is, immediately when that transition occurred, they had new data sources from virtual care they'd never had before. That data was immediately brought into Snowflake, and so they knew what was the clinical impact to the patients, what was the financial impact to the health system, what was the operational impact to the insanely overburdened clinical staff, nurses, physicians, and auxiliary staff. So they were able to do that within a matter of weeks, and then they could act on those insights and then make that much better experience for the patients, whereas quite frankly, other health systems really struggled with that transition to hybrid care. So that's just one example, and I think what it highlights about Snowflake is speed and agility, is that you're not waiting for months to have a solution brought to you by a team that has to build something from scratch.
I'm the regional director for sales in the Southeast for Dexcare. Dexcare was born out of Providence. It started in 2016. They spent about $40 million to solve a problem about patient access and capacity optimization. It spun out of Prov about 2 years ago, it'll be 2 years in March. Yeah, that's what we do, is we capture patients from Google, because Google is really your digital front door, not your website, and then we gently navigate them towards the appropriate venue of care, the venue of care that's appropriate not just for the patient, but for the system as well.
And who at the healthcare system would you like to talk to, and what is the conversation that you want to have with them?
Well, we typically end up starting with digital access, because it's their world. Marketing as well, because we touch marketing, we capture new patients. And then you get to operations and the providers, because we talk about opening up their capacity to higher acuity patients and giving lower acuity patients to maybe a more appropriate venue of care. So those are the three areas we typically touch.
And what are some use cases?
Shoot, I wish I could drop client names, but there's a large health system in Texas that had a problem where their providers are over capacity, but their mid-levels weren't being terribly used. It's a highly competitive market, and they saw that one of the competing systems has a very nice digital experience, so they wanted to, one, capture more patients from Google, capture that market in the competitive market, and two, navigate patients towards the virtual on-demand care or to an urgent care instead of letting them book with a primary care provider, so those primary care providers could see the higher acuity patients. So they signed with us in August. They're going to be going live next week. and their website will have this Amazon-like experience. So if you want to book an appointment with Dr. Anderson and Dr. Anderson's booked out for the next 3 months, it'll suggest Dr. Welch instead. Or if I'm looking for, if I have a cough, it'll give me providers that treat a cough, not necessarily trying to find a very specific provider by name. So we have lots of different use cases across, each system. They're all very different. They all want to use Dexcare differently, so
Wonderful.
that's us.
What a great group of healthcare partners. We want to thank them for spending some time with us on the floor and sharing their aspirations, their solutions for healthcare IT. I want to thank them for talking to me and talking to Holly and talking to our team on the floor. We also want to thank our conference sponsors who are investing in our mission to develop the next generation of health leaders. They are Sirius Healthcare, a CDW company, VMware, Transcarent, Press Ganey, Sempris, and Veritas. Thanks for listening. That's all for now.